We are live and we are back. It is the Front Page Saturday Town Hall edition. We've teamed up with our incredible sponsors, the Independent Professionals Association at indiework.org, Community Build, the City of Los Angeles, the supervisor from the 2nd District, Mark Ridley Thomas, and of course, our friend, the council member from the 10th District, Council President Emeritus, Herb Wesson Jr. Around here, we call him Herb. Good morning.
Hello.
Good morning. Welcome. Good to hear your voice.
Good morning to you, Dominique, and good morning to the Front Page family. Again, it's a pleasure to be with you on this Saturday. All week I look forward to my few moments on the show, which is getting bigger and better every week. I have to say that this has been a very impressive lineup today. Dr. Emeagwali and Dr. Taylor, I thought, hit grand slams and knocked it out of the parks. And they, Dr. Taylor referenced Morehouse and Emeagwali, Meharry. I think that it's important that we just highlight a bit of the value that we're getting from individuals that went to historically black colleges. I know we had the owner or the manager of Simply Wholesome. She went to Howard. Hopefully our next vice president of the United States will highlight. And again, I get to throw in, I went to Lincoln University, the oldest black college in this country. But I think today's show highlights that there has historically been issues with the black community and the medical community. And that when you have doctors that look like you, that sound like you, it elevates your comfort level, and I think puts us in a position to ensure that we are comfortable receiving treatment. So we really need to do a better job in trying to get more black girls and boys going to not just college, but to medical school, with about 13% of the population being black and less than 6% of us being doctors. I think that that's a huge need during times like this when you're hearing conflicting reports. I think that if you have individuals that are, black, then you feel more comfortable doing what you're instructed to do. But anyway, it's a pleasure to be on the show. We had some great guests, the supervisor, Dr. Dar, and I'm excited about listening to somebody that we're all proud of, and Dr. Reid.
Yes, Dr. Noelle Reid, of course, is a medical doctor. She's also, an African-American resident of your district. And you've seen her on TV, Married to Medicine. She's on The Doctors frequently, and also on a lot of news programs, just bringing people up to date on this pandemic in particular. Dr. Noelle Reid, welcome back to the Front Page.
Good morning. Thanks for having me.
So, Dr. Wesson, I almost called you Dr. Wesson. Herb.
Hey, I'll take that.
Well, Dr.
Don't
Wesson.
let me prescribe any medicine. And I could do some holistic medicine.
But he was talking about, why black doctors matter, and the fact that, we have so few. I mean, and we're looking at a possible shortage of doctors, particularly in our communities. Clearly, you've overcome that. Is that a conversation that we really need to be having?
Oh, for sure. Because it has been this way for decades. It's not something that is new. Unfortunately, there's always been a lack. And as it exists now, when it comes to representation of black people within the medical community, it's minimal. 5% of those physicians that are practicing medicine in the U.S. are African American. Only 2% are African American and female. When certainly, our population is greater than that. And I think that in any industry, not just medicine, you have to represent what your community looks like, what our world looks like. And that just is not the case when it comes to medicine. And I think that also impacts the way that we access and receive care. And the disparities in health that exist, it's for many reasons, but one of those being the lack of representation.
Yeah, and then of course access is an issue. And Councilmember Wesson, you were, instrumental in getting that Kaiser Permanente into our community, which is an access point for a lot of people.
Well, it is always challenging, and I just have to thank Kaiser for making a commitment to come to our community, and we were able to all work together and to get it done. But I wanted to mention something because I want to hear from Dr. Reid and get her opinion on this. Testing. We as a country have botched the testing process. Again, on this show that you host and at the radio station owned by Stevie Wonder, we have been calling for some kind of national testing protocol for 3 months or longer than that. But I think that it's important that we have to begin taking testing to our people. And so what I wanted to report to you is in partnership with Labor and the Central Neighborhood Health Foundation, what we've been doing, Dominique and Dr. Reid, we have been taking testing, mobile testing to senior citizen complexes within the city of L.A. and just knocking on their doors and testing them. We've been to Skid Row. At my office, we offer testing. We announce it, and we take the first 200 or 500 people that come in and get free testing. And I think Dr. Emekwali and Dr. Taylor talked about the importance of testing. But what blows my mind, again, and I don't know if it's just based on our history with medicine, it's challenging to get people of color to take the test. I had a member of my staff told me 2 weeks ago, oh, my girlfriend got tested and she doesn't have it, so I don't need to get tested. So I made his butt get tested. But, so we've got to aggressively take care of ourselves and empower ourselves. Doctor, why do you think that there's this fear of us getting tested? And is it a good thing for us to make it just so overly easy to test that people can't refuse getting the test?
Well, definitely when you make it easy, that always changes things. So we always want to, do anything and everything we can to improve upon access. And I do think that fear is really the overriding issue across the board. Whether we're talking about testing or we're talking about representation in clinical trials. So I don't know if you guys are familiar with the clinical trial that's going on currently for the COVID-19 vaccine, that there's been an issue with representation there of Blacks and Latinos. And I think at the end of the day, the relationship between Black and Brown communities and the healthcare community, there has been a gaping wound that has been present that is historical. And I think that the fear that exists to access and the level of trust, rather distrust that exists is what impacts our ability to go in to get proper testing, to follow recommendations when it comes to certain therapeutics and vaccines, to just show up, within the healthcare realm. And, it's warranted, because when we look at the history, if I can just give a brief history lesson, we can go all the way back to times of slavery, with the father of gynecology, J. Marion Sims, who was doing experimental gynecologic procedures on enslaved Black women, of course, without consent and without the use of anesthesia, despite there being anesthesia present and available at that time, to the Tuskegee experiment that, I'm sure many of us are familiar with, that went on for 40 years, between 1930s to 1970s, where many black men died due to syphilis, despite penicillin being available that could have been given but was withheld purposely to look at the process of syphilis solely in the human, but they were not treated as humans. To present day, when we look at observational studies where African Americans that show up to the ER with the same pain level as their white counterparts get less pain medication, and perhaps show up to psychiatric ERs and are over medicated with antipsychotics compared to other groups. All of these things have impact. And so whether those in the community know this data or not, I think it has an overriding effect on us. And we have to push past that, because at the end of the day, we're going to suffer. At the end of the day, when we don't show up for these tests, when we don't get the screenings that we need, when we're not represented in these clinical trials, it impacts us. And so yes. I don't know the best solution, but I think that, it starts with just communicating, and going into the community. And just as you have mentioned, knocking on doors, just inundating with information and making it easy to access healthcare.
Dominique, there's one other thing that I wanted to highlight that I have been discovering the last 30 days is that our Latino community is significantly under tested. And then when you hear that 40+% of the people walking around that have COVID-19 exhibit no symptoms, it's important that we test everybody. Just because you think you're okay doesn't mean that you're okay. But their problem is unique in that some of their relatives may have issues documentation-wise. And so we need to try to develop some kind of no questions asked testing so that we can get them to come out as well. And that's a big challenge.
And honestly, Herb, I think that is an issue for a lot of black people, too, that maybe isn't being talked about, because the conversations I've had, people don't want to get tested because they don't want to be contact traced. Now maybe you can't go to work, or now maybe you think you're in the system and somehow this is going to come back to haunt you in some other way in terms of discrimination in the future and such. So I think that is an amazing idea, Council President Emeritus, a.k.a. Herb, is that, if people could get the information, then they would probably self-isolate and protect their own families. But if they could do it without feeling that they might be penalized for doing so.
Yeah, well, that's something that I really want to get at, really want to look into putting in place, because we all live together and we all interface with one another every day. And it doesn't do any good if I'm fine and my neighbor or across the street is not.
Yeah, absolutely. In fact, especially when you look at, the fact that African Americans and Latinos are working a lot of these service jobs and are actually in contact with others all the time, it's going to be vital. So I love that idea. We're talking about the latest science, Dr. Reid. We've talked a lot about masks this morning. There's still a lot of skepticism. We were talking about testing, vaccines. What is what is an update, and I know you're on top of this stuff all the time, that people may not know about in terms of the latest science for COVID prevention?
Well, in terms of prevention, I really think where we have been, and that is minimizing human contact. And any way that we can do that is where we need to continue to keep our focus. So that means wearing the mask, keeping 6 feet distance, and reconsidering, how we're reopening the communities and opening our schools. I think that there has been a greater concern in regards to how this virus is actually transmitted, in terms of, perhaps it being more of an airborne transmission than just, respiratory droplet transmission. And so that really pushes the point that we have to continue to wear our mask. and keep distance, because there has been, more research that suggests that, these droplets, the smaller droplets that may be, expressed through talking or laughing or, conversation or what have you, to spend a little bit longer than we thought, and so that means that it's really important that we stay vigilant in wearing our mask and distancing ourselves, as we continue to try to prevent and mitigate spread.
Probably the biggest question I hear from everybody all the time, and I don't know if you've seen any data on this or projections, Mr. Wesson or Dr. Reid, is when do we think we might be able to get, back out and about? Is there any projection about that right now?
Well, you know what? If I could just jump in.
Yes, please.
I don't think we can count on any projections because people don't know. So this is the time for us to really empower ourselves and to do everything that we can. It's our responsibility to keep ourselves safe. I would, plan for the long haul. We as a people need to plan for the long haul. And, it may be slightly premature for us to talk about cures and vaccines, but I think we need to start going on the record right now that in and when one is created, that we should be the individuals that are first in line to get this vaccine, because we are the essential workers who have kept this country going throughout this whole process. Blacks, Latinos, and the working poor, those are the individuals that have kept this city running, that have kept this country running. And so what you don't want to see when this is put together, you don't want to see us at the back of the line when we're the ones that are out there every day. We don't want this to work like it did with the testing, where the testing started out in areas, affluent areas. The testing needs to be taken to the people. The vaccine should be taken to us or given to us as well, is because we're the ones that are working in the grocery stores, driving the buses, picking up the trash. We're the ones that are keeping this country moving. So that's something we need to start demanding today.
Definitely a concern. I think there's also a concern that
still needs free masks. All they have to do is go to Wesson.com. We've given out over 40,000 masks.
Wow.
Email us, and we will give them, to anybody who needs them for free. And we've been doing that on this show for 3 months or longer.
That's amazing. We're almost out of time here. I don't want to delve all deep into this, but I know a lot of people are concerned that they'll be forced to take the vaccine or forced to have it for their kids to go back to school. You have any information on that, Dr. Reid?
I don't know about there being any mandates in regards to vaccines. I think we haven't even gotten to that point yet.
Right, right.
And so I think right now it's just kind of trying to work through the phase 3.
Think of something else to worry about. Is that your
point? But, if that day does come, again, no one can really give any definitive dates. But I do think, just looking at what happens historically with clinical trials, most phase 3 trials take at least a year, and so, Moderna, one of the trials that's going on currently, they are now in phase 3. They just started, this summer. So what I anticipate is that we will likely have a vaccine perhaps by next spring or next summer, likely not January, that summer, toting, but perhaps in a year's time, we will have a vaccine. Now, whether it will be at a level of development that is ready for the masses, that's another question. And then moving forward from that, what the mandates will be, I think we're just going to have to wait to see what happens in that regard.
Got it.
So, that's kind of where we're at.
Herb Wesson, we just have about a minute here. What would you leave us with this morning?
Well, first of all, thank you for bestowing the title of doctor on me, but I'm not going to practice. I'm going to defer to Dr. Reid and Dr. Taylor and all of the other experts that we had today. But I think that this is when we have to really make sure that we take care of ourselves, that we do everything that we can to stay safe I think that whenever there's an opportunity to be tested, get tested, and I'm just committing to the community that I'm going to do everything that I can to take testing to the people, our seniors, and to the essential people that are out working every day. I want to try to make it as easy for them as possible.
Dr. Noelle Reid and fake doctor, council member Wesson, thank you both so very much for being with us. Family, we got to go. The Great Guy Black is next. Until next time, Radio Free Family, one love.
It's The Front Page with Dominique DiPrima on Radio Free 102.3 KJLH.